Good afternoon, Conference. 2 years ago, NHS England published the General Practice Forward View. Why did they do this? Well, because general medical practice was going down the toilet. Sustained underinvestment leading to a chronic shortage of GPs, and in some parts of the country, the closing of practices because recruitment proved nigh on impossible. The government recognised there was a serious problem, and that paper was a response to their looming disaster. Recommendations were, amongst other things, to increase funding by £206 million over 5 years to address this recruitment crisis. So does that sound familiar? Well, not exactly. You ask colleagues in Cumbria, in Norfolk, in Cornwall and Devon whether there's a recruitment problem in general dental practice, and you know the answer that you'll get. It is a looming crisis. And what is the Department of Health and NHS England's response? Not a penny of investment. In fact, according to the evidence submitted to DDRB in the last round, they claimed that there was no recruitment crisis. So what's happened for them to wake up and realise that the grip that NHS dentistry has to that cliff edge is getting more precarious every week? It's time that they acknowledged the problems and sat down with the profession to attempt to address them. Recruitment may not be solved entirely by throwing money at it, but it seemed to be one solution for the GPs. NHS dentistry is becoming less and less attractive for school leavers and overseas dentists. And with PLVE and Brexit making the situation worse, there are a number of areas to be worked on. Oh, and I hadn't forgotten to mention Capita's contribution to the workforce problem, but then you would have expected me to say that. Of course, that is only half the problem, with the morale in the profession so low that colleagues are leaving in their droves. But perhaps that's a subject for another motion. The Commissioners of Primary Care and those civil servants at the Department of Health, and I'm delighted to see that there are some of the civil servants from the Department of Health with us today. Thank you for coming over. But they've got to recognise the problems, get out of their bunkers and join with the profession to identify the solutions. This will almost certainly involve investment. If they choose to not follow the GP model, then we will lose our grip and plunge over that cliff with NHS dentistry disappearing forever. Or is that what they really want? Conference, I urge you to support this motion.
We have no speakers yet to speak to this motion. Shall we go to a vote? So, all those in favour? Thank you. All those against? Abstentions? That looks as though that's carried unanimously. Thank you.
Hello again. So, general dental practitioners across the UK rely on the skills of community dental services to help their patients, particularly those with special needs, and in some places for those patients who sadly need treatment under general anaesthesia or sedation. In England, some of these services are contracted under UDAs. This is completely inappropriate for patients who often need extended time and limitless patience. Across the UK, services are starved of investment. Some face uncertain futures due to poorly thought through tendering processes. Others struggle to recruit the skilled staff that they need due to shortages of colleagues with experience of special needs or paediatric specialists. Let us add our voices to support our colleagues in community dental services. Please support this motion.
Have we anybody that wishes to speak to this motion? So we'll go to a vote again. So all those in favour, can you please hold your cards up clearly? Thank you. All those against? Abstentions? Okay, that's a majority, I think.